Hello, I apologize for the awkward angle of this video, but this is just the most convenient way for me to set it up. I'm sitting on my couch. Um, we were all asked to present a video, just presenting what situation we're in. My name is Daniel. I'm 44 years old. I live in Queens in New York. And a number of years ago, about 6 years ago, I suffered some enormous back pain, and long story short, after months of having different treatments, I had surgery. The surgery fixed whatever was wrong with the disc in the lumbar region, but ever since then I've suffered from chronic pain. I have severe, excruciating pain 24 hours a day, but I was treated initially by a variety of things, medication, opioid-based medication. And initially I had, for maybe like a year and a half, I had a series of epidural injection treatments, none of which helped, although I tried and tried and tried. I must have had a dozen of them over the course of maybe a year and a half, 2 years, no, maybe 2 years. And I tried a variety of medications. There's prescription medication that's non-opioid. I tried about, I don't know, I tried so many that there was nothing else. Even ones that the doctor said, maybe it'll help, I don't know. I was even forced to get prescribed and try a medication that I will not say allergic to, but for all intents and purposes I'm allergic, because years ago when I took it, I had a horrible reaction to it. I told my insurance company that, but they said, well, we won't authorize a certain medication unless you first try this, because that's what we say is like the cheaper alternative. So I got the prescription for it, took one pill. I didn't even take more because I knew, and as expected, I had this horrible reaction. And then I was given the other medication, all for naught, because none of this helped. I had a series of MRIs, I had EMGs, I had tried a spinal cord stimulator with a neurosurgeon who's a specialist in rehabilitation, and it caused all my muscles to spasm. He said that some people react like that, not everybody, because there are people who use an SCS successfully, but some people will have this reaction. There's nothing to do about it. Again, this is a really good doctor in Montefiore Medical Center, and he was very disappointed. He looked actually like quite, defeated. He's a very nice guy, and he couldn't make the SCS work for me. So what's left is, all I have is medication. With that being said, I've been on oxycodone and OxyContin. I had a quality of life. I had to shut down. I shut down my company of 15 years. I ran an IT company. I was a sole independent contractor. And I ran a successful company, and I provided IT services for clientele around New York, and I had a loyal clientele that I had had for a long time, even from the job that I had prior to my own company. I had to shut this company down and liquidate it because I couldn't work anymore. I'm in the process of going for disability. Despite all of my ailments, I was declined immediately when I applied for disability. They just said back pain not sufficient. So they don't even read it, they just deny you, and then you have to appeal. That's the way it is already. It's so messed up that you're not going to, you could have had all your limbs severed. You're not going to get disability unless you get denied and then appeal. That's New York. That's just the way it is. So I'm in the process, and I'm hopefully going to get a court date in not too long. I have an attorney representing me, helping with this case. But nevertheless, I had a certain quality of life. I was able to function. I even started doing a hobby and making jewelry and putting it on Etsy. I have some items that I was able to learn to do on my own, and I got some equipment. My wife has been supporting us, in addition to other family, giving us a little bit of financial help. And so I was able to do some things. I was able to spend some time with my son. We were able to go to at least, annual family get-togethers, things like that. The pain management facility that I was using, they got so scared of the DEA that they stopped prescribing altogether. They said, weaning people off or telling you, hey, find a new person because we're going to stop prescribing and go only to other kinds of treatments because we just don't need the headaches of them threatening us all the time just for doing our jobs and treating our patients. And so I found a new pain management doctor who was willing to take my case, and they've been treating me, but from the day one, they cut me down by 33%. In other words, they only started me off on 2/3 of the dosage that I had been on. I mean, I'd already been to the emergency room once because the previous doctor had cut me off and not kept me going until I find somebody else. They cut me off, and so I went into withdrawal. I wound up in the emergency room. And so my current doctor has been treating me for a little less than a year maybe, and now they decided they're cutting everybody off and they're weaning you down. Even if there's nothing that could possibly work for you. I mean, my wife came with me to last appointment, and the doctor openly admitted, even if we try everything, even if we tried it already and we're willing to try it again just to satisfy their need, they will be weaning me off of the medication. They cannot keep me on this medicine for the same reasons. They're all scared of the DEA. They cannot provide health care for their client, for their patient. They are forced to cause suffering rather than relieve it as doctors, as physicians. They're all forced to betray their Hippocratic oath, which I know is meaningless in the year 2018, 2019 coming up. It's meaningless. We all know it's meaningless. Because medicine's a business in this country. It's not even about healthcare. But there are doctors who care, and yet they can't help you because they say, I can give you the medicine that is enough for you, if taken as prescribed, that you can have a certain quality of life and you're not in terrible pain. I'll lose my license. They'll just come, see that I prescribed this amount, say it's too much, now you're not a doctor. And this is what literally doctors have told me this straight out. It is now punishable by taking away your medical license to treat properly with opioids. Nobody overdoses from taking medication prescribed by a doctor, as prescribed, as indicated, the dosage. People don't overdose like that. That's not anything going on. So why they're attacking just doctors and patients when the real problem is illegal drugs, street drugs, that are made not by a good company where it's known to be an exact dose of an exact ingredient, and therefore you can safely take it. These things are all done, I don't know by who, but they are smuggled into the United States. They're illegal, and people who overdose are people who are using those drugs. There, these tens of thousands of people that they're claiming overdose, not a single one of them is somebody like myself. And not a single one of them is somebody who needed it the way I do, and the way so many people like me do. I have experienced a serious decline in quality of life. My life now consists of being home every day, all day, occasionally going out, but not being able to spend more than a couple hours out before I'm in too much pain and I come home. I can't really do much of any hobby anymore. It takes me sometimes a week to muster up the strength to do the dishes, and then I'm in a lot of pain and I have to rest after that. So my quality of life has been completely taken away, and I'm in pain all the time, thanks to politicians in this country who are using this issue. It's propaganda. It's like an enormous advertising campaign for their career, and none of it is legitimate. It's all fabricated. There is not a problem in this country of opioids being prescribed by doctors to patients who are suffering, and the patients taking them as prescribed and having regular follow-up visits. That's not a problem of overdoses. None, not one. It's all the illegals. But you know what? I don't think none of the politicians want to start an international drug hunt. And so this is easy. They put on a show, and then they show what they're doing, and it satisfies enough of their voters who are none the wiser, It's one big show. But they're also putting people like me into unending suffering. I'll admit straight here on camera, I think every day I think about whether or not I want to continue living. And I do only because of my family. But every day I read in my support groups online about another person who was committed suicide because they just couldn't take it anymore. As far as I'm concerned, the Drug Enforcement Administration, the people in charge, the people doing this, they have committed multiple murders, as far as I'm concerned. There is a direct cause and effect relationship here, not one that they couldn't see coming. It's a very, very simple and plain as day cause and effect relationship, and they know what they've done. It's all for their careers. It's all for money. As far as I'm concerned, our government's culpable. They've committed murders, and they're continuing to commit murders. They're taking away medical treatment that works for people for no other reason than because a completely unrelated issue that they're using fabricated figures to bolster, and using it for their campaign and using it for their political career, and not actually doing anything about that problem. But it's all smokescreen because most people don't really know enough to look into these things. Most people don't know what this is about. They just believe what they're told, even though what they're told is all lies, 100% lies. It reminds me of the Soviet Union, the former Soviet Union, who used to make jokes about it, how hey, the government says this and that. But that's what's going on in the United States right now, and people like me are suffering. Well, that's where I am. I'm now in the process of having to find another pain management doctor. Maybe I will find one who's willing to prescribe to me minimally what I need, or maybe I won't. Maybe I'll wind up in the emergency room. Maybe I'll wind up bedridden. Maybe I'll wind up killing myself. I don't know what's going to happen tomorrow or the next day. But what I do know is that I suffer more and more every day, and doctors are now prohibited from relieving my suffering. This is where we are now, and there's millions of people like me in the country. This is where we are now, and the only people who care are people like myself and a few outspoken doctors who have had the guts to come forward and say something about it. But our government, that's what they're saying. They just don't care. They don't give a damn. What I think has to happen is somebody has to sue them individually as people, whoever the chairman or president or whoever of the DEA, the CDC, whoever's been playing these games, they have to be sued and they have to be prosecuted for multiple counts of murder. And I would dare any lawyer in the country to take that case on. I challenge you, because it has to happen. It's not going to win, but it has to happen because this needs to change. Because more people are dying. I predicted this a year ago. I said you're going to see an increase in suicides, and sure enough, that's what's happened. And you're going to see more and more. And you're going to see people like myself turning to the street drugs because it's the only thing we can do. We have no choice. It's either that or be in pain, in bed, every day, all day, like invalids. That's what our government has prescribed to us. There's no gray area here. This is black and white. This is exactly what's happening, literally, no exaggeration. And it's happening to millions of people like me, and it's not going to change. There's no indication it's going to change unless a serious fight goes on. And people like me, I don't have the strength to fight. I'm in too much pain. I can't go marching and rallying. We're for the most part helpless, and we don't really have much in the way of advocates, because who wants to go after the Drug Enforcement Administration? Who wants to go after the CDC? But that's what needs to happen. We need a brave attorney, a brave law firm to go after them and sue them for these deaths, and sue them for causing pain and suffering. They're causing millions of people to have agonizing pain when a simple medication that's been in use for hundreds of years will Give them pain relief in order to have some semblance of quality of life and for them to be able to live their lives without so much pain that is debilitating. That simple remedy, for political career reasons, is being cut off from us. It's murder, end of story. And it's damaging our bodies and our minds. This is the fact. Mass murder committed by our government in our country to innocent people who are ill. If you don't accept that, then you're already gone. You're lost. You're in a delusional state. If you look at this and you see that this is where we stand, now you know what's going on. What are you going to do about it? What is anybody going to do about it? So that's where we stand. I don't know where I'm going to be tomorrow. I don't know where I'm going to be the next day. And I don't know about anybody like me, what we can do. We're kind of helpless and hopeless because we're in too much pain all the time. And everybody feels sorry for us, but nobody's doing anything for us. So you can watch the people drop like flies. You can watch the body count keep going up. Or you could speak out. You could do something. You can call your local politicians or whoever. You can demand that this change. If there are any attorneys out there who are gutsy enough, sue the DEA on our behalf. If there's a prosecutor who's willing to take the DEA to task for what he's done and prosecute him for wrongful deaths, because it's not an exaggeration, it's not a stretch, it's not a reach, it is a direct, foreseeable cause and effect relationship that millions of people have shouted was being done. He's hearing the screams and he's hitting the button on the gas chamber. That's what he's doing. I'm not exaggerating. So that's where we stand. I hope people hear this. I hope many more people speak out like me. This is the most I can do right now. And I just hope that it changes soon, because I don't know what my future holds right now. I have a son who relies on me. I have a wife. I have my mother. I have pets. I have friends. And I'm here for them right now. I'm really only here for them right now, because my existence is pain now. So I wish everybody the best, especially people in my position, and I hope that we see something change soon, like now. It needs to change right now. It can't be tabled or put on an agenda. It needs to change literally this minute. That's it for now. Thank you for listening.